Good afternoon, everyone, and welcome to our webinar today using mental health consultation to support the emotional, social development in early childhood education. And this is a very timely topic, as most of you know. For those of you who don't know the Bipartisan Policy Center, my name is Linda Smith, and I'm the director of the Early Childhood Initiative. And BPC is an organization based in Washington, D.C. that strives to take the best ideas from both sides of the aisle to promote better public policies for the issues facing America's families. And there's probably no more pressing issue than that of the stress on our families, our children, and also on our childcare providers as they seek to get our families back to work and life back to normal here in the United States. Before I go on, I just want to say our thoughts and prayers go out to the people in Alabama today for what's going on with the tornadoes and the destruction down there, as well as what has happened in Atlanta and Boulder, Colorado. And we're all thinking about and very concerned about the added stress in these communities with these recent events. So to get started, I want to just say what set the stage for this webinar today. In the last couple of months, BPC has been having conversations with both childcare providers, family childcare, as well as center-based. And what comes up in all of the conversations has been the pressure on parents and children alike, and the subsequent stress on those who are caring for the children in these programs. As we know, the recent American Rescue Plan included funds to support our childcare programs and specifically called out mental health consultation as an option for the use of this money. So what we want to do today is examine one model that has been used around the country. And I think it will come as no surprise for any of you to hear the name Walter Gilliam, who has been the leading researcher on this. Dr. Gilliam is with the Ed Ziegler Center at Yale University, and his colleague, Dr. Reyes, who is the research scientist who recently completed some very important survey or study on this. Then what we're going to do, though, to set the stage for this first is talk to a parent who this was a very real issue for, and she's very articulate in describing the impact on her and her child as a result of this. And then we're going to turn to Neelam Sani, who is the director of a childcare center and actually working right now with staff in terms of this issue of supporting them. And then finally, we're going to have Tina Sloan, who is the vice president of the Early Childhood Mental Health Consultation and Training Program for Kidango Incorporated in California. And she is a mental health consultant, and she's going to talk about the impact all this has. So I think this is going to be an interesting conversation, starting with how this has impacted a parent in particular. So what I'm going to do now is turn it over to Dr. Gilliam to give just a couple of quick seconds about his work overview, and Dr. Reyes, and then we'll go on to talk about the impact this has had on parents. So Walter?
Thank you, my friend Linda. And thank you for hosting us here to talk about this topic. As you had said before, states are now going to be having an unprecedented amount of resources to be able to try to open up schools and childcare programs in a very responsible way. But the pandemic has created a massive amount of stress, not only on children and their families and communities, but also on these childcare providers. And so rightly so, when the legislation was passed in terms of the appropriations, they made sure that we realized that some of this money should go towards thinking about the mental health services. We've been studying this for a very long time. And so it's an honor to be able to talk to you about some of the things that we've learned. And most of those things that we've learned have been due to the hard work of my dear colleague, Dr. Chen Reyes, who will introduce herself right now.
Yeah, so just to add to what Walter had mentioned, like we're just happy that we can provide you with evidence that we have, at least from 2 states right now, from rigorous randomized controlled trials. So we're excited to share the latest study findings that we gathered.
So I think that you'll all be really anxious to hear the outcomes of their study. But before we do that, let's set the stage by first talking to Tunette, who's, as I said in the intro, has actually had firsthand experiences with this, with she and her child. And then we'll turn to Neelam, who will talk about the impact and some of what has gone on, what her teachers have had to say about this issue to set the stage for the research and then where we go from here. So Tunette, let's go to you first.
Thank you, Linda. Old folks say trouble don't last always, but I can't shake it. What they do now, every time the phone rings, I can't fake it. Can still see the hurt in my grandmama's eyes. You just like your daddy, girl, we ain't gonna make it. We all walking around with the cycle. It feels like trouble, we ain't gonna shake it. Feels like a cycle, we ain't gonna break it. And my mama crying out, Lord, I just can't take it. School said I was bad, so that became my new name. After so many suspensions, you're never the same. Watch the adults around me play the blame game. Laugh like you don't care to keep from going insane. No matter how far removed, I can still feel the pain. 20 years passed, but I can still see the stain. School did more damage to us than crack cocaine. Trauma so deep that it runs through my veins. But this ain't strange. This is as normal to black as normal as Seattle sees rain. But y'all don't see us. So the trauma means. I start there. And I start there because my educational experience has been one that has been very interesting and filled with trauma starting from a very young age. And so I'm going to take you through this journey of the bars that I shared so that you can hear and break down what that means and why that's important in this context right now. Old folks say that trouble don't last always, but I can't shake it, right? What they do now, every time the phone rings, I can't fake it. In 2014, when my oldest two sons, when they were 3 and 4 years old, they were suspended from school. And it rocked my entire world. It was this moment for me where as an adult, you feel that, and as a parent, that you think that, you've done the right thing. You've read the books. You've spent the time, you've invested, you've volunteered at the school, tried to do all of those things that we have said are good, matter, right? And what it was, and what you hear in this next verse when it says, can still see the hurt in my grandmama's eyes. You just like your daddy, girl, we ain't gonna make it. We all walking around with the trouble. It's a cycle, feels like we ain't gonna break it. What that did for me is it took me back to my childhood where I was expelled, from preschool, where it was a moment, it was a different pandemic. It was the war on drugs, right? We were in the middle of the war on drugs era where, drugs were placed in Black and poor neighborhoods. And so that was our pandemic. And the way that it was handled was my father was incarcerated, right, for half of my life. And for me, who was dealing with all of the things, for my family who was dealing with so many things, we were pushed out of schools. And so that's right what I sit with. So when it happened to my children, it was a disaster for me, right? It was a collective trauma. It was an echoing of the trauma that was so familiar in my childhood. And so again, as I talk about these things, and I'll take you to the end part here, where we talk about collective trauma, because I say these words where I say, no matter how far removed, I can still feel the pain. 20 years passed, but I can still see the stain. School did more damage to us than crack cocaine. Trauma so deep that it runs through my veins. I say that not as just as an anecdote or something that sounds good, but as something that is very real. That every time, because of the preschool experience of my kids, because of the preschool experiences of myself, every time I have an interaction in education, it's there. It sits with me, right? If a teacher reaches out, even if my kids have had a fantastic year, it creeps back into my mind, right? All of my interactions have been shaped by my early childhood experiences and by the early childhood experiences of my kids. And in all of the work that I've done with parents, because I have been working with parents since 2014, parents who have had kids suspended and pushed out and harmed in early childhood settings. And it very much is very real. I never forget, I was talking to a parent and interviewing and working with a parent whose child had been suspended. It had been almost 30 years. But when she told that story, you would have thought it was yesterday. It was so fresh, right? And so real. And that's why I finish off that verse with saying, but this is not strange. It's as normal as to Black, as normal as Seattle sees rain. But y'all don't see us, so the trauma remains. And so when we think about this work, of being in a pandemic right now, knowing all of the stress on everybody's end, I want us to think about a few things. Number one, I want us to remember that this is not about children. The issues that we are having in our early childhood settings are not about children. They're about adults. They're about systemic racism and anti-Blackness. We cannot have a conversation about early childhood and how we're going to support and thinking about what we do in this pandemic without putting systemic racism and anti-Blackness in the conversation. Even if we support educators in every way, even if they're well and they're healthy and they feel good, if we don't remove some of the policy and some of the barriers that make it very easy to push Black kids out, that make it very easy to adultize and refuse and reject sense of young people, of children, then we're going to be back at this same place. And so my call today, as I lift up the Black parents who could not be in this space, as I lift up the young children, right, who are simply being children, who are stressed out, who have to think about things like, the socioeconomic status, right? That education is shaped by our zip code and so many other things. As we lift them up today, I hope that we will be committed to getting this right, because this is not new. When we talk about these issues of what's been happening, they've been happening since schools were desegregated, right? As soon as schools were desegregated, Black kids were the most suspended kids in every single setting. It's just a matter of what we had data for. And so we always have this, we talk about progress a lot. We talk about, resilience a lot. But I'm going to borrow from Bettina Love as I end and think about, we want to do more than survive. And so the question that I bring into this space is, what are we going to take from today's conversation that will allow Black children, Black families to do more than survive? Thank you.
Thank you, Tanette. Let's go to Neelam now. And Neelam, you're working with parents and children and child care staff right now. Talk about your experiences.
Thank you, Linda. And first of all, I'm very thankful to Kidengo to provide us this opportunity that we have the mental health consultation session once a week on our site right now. And as you all know, this year was a very stressful year, full of anxiety, fear, depression. During shelter in place, I found out that some of my staff members, they were emotionally disturbed, financially disturbed because the partner lost the job, the companies were closing. Family members were out of the country feeling loneliness. And then the day came, the Kidengo decided to reopen. Everybody was feeling unsafe, unsecure, going back to work. They had no childcare for their own children because schools were closed. And school-age children were at home as well. But there was no choice. We need a job. We were essential workers. We have to go. And the day we were about to leave, one more thing happened. George Floyd couldn't breathe on that day. He was begging, I can't breathe. And it felt like we were all not breathing. With those emotions, going to the site, working with children, with families, with staff. Hard for myself too, and challenge for the staff too. Then we did have a COVID exposure. Families were upset, feeling not secure if the baby will get the COVID, running for the testing the COVID, and because of the quarantining and closing the site for that, they were about to lose their jobs too. So goodness, the Kidengo offered us the mental health consultant session, and I was thinking and feeling that why are they adding one more thing on me now? How I will manage all that? But by joining the first time session, I figured it out that it's gonna help me because I saw the staff was relaxing. And after that, they were working in the classroom very professionally, effectively. And after that, in each session, it happened, and we were able to build a strong team that we are calling now EYC family. And our own mental health consultant, Bailey Bear, is a special member of that family. Any email I write, any communication we do, we are including Bailey. And I'm gonna read some of the comments from my co-workers that I would like to share. And first, I do have teacher Miriam Acosta Torres. When I asked her how did it help us this session, and she said that consultation with Billy has very helpful for many reasons. First, I really appreciate the 5 minutes we set aside at the beginning of each session to meditate. It allows me to slow down and get in touch with my body. Secondly, it allows me to use this space to reflect on how our class runs and how we can improve the flow. And third, I can share some of the challenges I come across professionally and personally. I can share some of the cases as a group. We discuss different strategies to address these challenges. Sorry. And I am very grateful for being part of the organization that creates a space for us to have consultation. Thank you, Gringo. Then I have my other teacher, Cecilia Lara. I would like to thank everyone who has helped mental health get to the point it is today. I feel like I benefit from it a lot, being in this center and focused on being going great and not so great as well. I would like to thank Billy for hearing us out every week and being patient with us. Not only do I get to express about things at work, but also things going in my personal life. It benefits me by cleaning my mind and after each session, starting all fresh in the classroom. It helps me slow my thinking during that time and not have 1,000 things going in my mind. Thank you for all you do. And then I do have teacher Yolanda Brown's comments. I like the session that we have with Billy every Tuesday because she makes it fun and relaxing moments where you have able to open up and express your feelings about what's going on and any issue you may have. She listens, you don't feel judges, and she's very easy to talk to even it comes to issue. We may have it. Work we can talk to her about. It gives us feedback and ideas how we can solve our problems. So I really enjoying this session and I want to say thank you. And being a director, what did I get benefit? That I go deeper into the feelings of the staff. I started daily checking in with them. How are they doing? Who had a COVID? I was sending like 3 to 4 text messages to my staff who was having COVID, sending my best wishes. And then we all know when we come to the session that who is sad, who needs help with the homework, who needs to take care of the mother at home. So staff and I, we started working together and we started helping each other, and it really became very helpful, and we were feeling like we are enjoying our life, and it was directly affecting to the children and the families. It did help us to build our relationship with the families. We were able to calming them down whenever something happened. Okay, we are gonna deal it with all together and we will be go over. And after that, I just want to share that how Billy was running the session. How did it help? So in the first few sessions, we were just having the introductions of each other, come to know about each other. Then she started with 3 minutes of meditation. And after that, staff was feeling, wow, did I get 3 minutes for myself? Then it extended to 5 minutes. After those 5 minutes, she will do check-in with each staff member where they are all open up. Nobody is judging. Everything we are keeping confidential over there. And there is any problem, the problem solving start happening. And then after that, going to the classroom, then working very effectively, very professionally. And also I would like to share one more very successful story that happened, that we did not have any shed for the toys for the toddlers. So all the toys were staying outside at night, and we do have the area where we have lot of homeless people. They jumping over the fence, sleeping there, urinating there, and staff was very feeling unsafe and not healthy by that way, and they were asking for a shed. I reached out to my supervisor and we tried to get a shed, but our budget didn't allow us. And then the family advocate, because she was also the part of our meeting, she reached out to our Head Start manager. I just want to highlight her, Rachel Javier, and she have done all the efforts, and we did get the shed. And we are just right after this session, I'm gonna go meet my facility manager, and we're gonna have a shed for the children. And I see the smiles on face. I see my staff is waiting for that session, and I make sure that I cover their lunch breaks, and I make sure they are there, and it is for them that session. So it's really, really helping us, and I want to say thank you.
Mhm. Well, I want to thank both Neelam and Tunette for their comments. I think this sets the stage for a conversation that has, been needed for a long time. And to Tunette's point, I think it's fair to say, Tunette, that the stress at the time was real and the stress was ongoing. And I think the residual from this, these things don't go away, and the scars that they have on children and families last a very long time. And I think the same thing is true for our childcare staff. In the situation that Neelam, you were describing, the stress of family members losing jobs. I think what we've learned out of COVID, some of it's not new, and I think we all know that some of these things have been around for a very long time, and some of them have been exacerbated by what's going on with COVID. So there's a lot of things to think about as we move forward with this issue, and especially with mental health in early childhood. That the consequences are enormous for a large population of people. So I want to turn it now to Walter, to you and Chin, to describe the work that you've been doing. Walter, we know, is the nation's expert on this issue of mental health consultation. The issues of the inequalities that Tunette talked about in terms of race and what's happening with young children in early childhood. And Walter can go into better detail than I can by a long shot. But he's spent a lot of his career looking at this, working on this, and now getting the research to back up exactly what, Tunette, you learned many years ago, what we've known for a very long time. So I'm going to turn it over to Walter to give an overview of this issue, and then he will turn it over to Chin to give the details on the study. So Walter, it's over to you.
And thank you very much, Linda. I mean, I can't tell you how wonderful it feels to hear the perspective of a parent and the perspective of a teacher talking about a topic like this. I mean, for a very long time, the issue of children being expelled from preschool programs, or the stress that teachers experience in having to make these hard decisions, were things that happened in silence. I mean, there's no parent who drives down the road with a bumper sticker that says proud parent of an expelled preschooler. And there's no teacher who feels good about it. I mean, they expel children because they don't know what else to do, because they don't have the supports that they need in place. Nobody wants to expel children. These amazing providers go into the field that they go into, making half the pay of a kindergarten teacher, for in many cases much more actual time working, because they care about children. And in exchange, we as a society, we just don't support them like they should. And so hearing from their perspective is just wonderful to hear. I remember when Dr. Powell first started writing about the perspective of this from that of a parent whose child had been expelled, and feeling that, for the first time ever, we have somebody who's actually breathing soul into this topic, and I'm grateful to her for that. And so I thought that I would start off by saying a few words about the fact that, the problem is an old problem, just like what Linda was saying before. Children have been expelled from preschool programs ever since we pretty much had preschool programs. And as Dr. Powell had mentioned before, ever since school desegregation had happened, there's been disproportionality in who it is that gets expelled from preschool programs. When I first started doing work in this topic, I was interested primarily in how do we get children into high quality preschool programs and high quality early care and learning environments. And then I couldn't help but notice over time that as we were focusing on how do we get kids into high quality programs, that there was a force pushing them back out the back door. And it was a disproportionate force, pushing more of our children of color out the back door. And it just became unbearable to not pay attention to it, and so that's where a lot of this work really came from, but then something happened recently, and that's that about half of all of our children in child care programs, because of COVID-19, half of them got expelled anyway, and as a result, there's just a massive amount of stress. We're going to have children coming back into childcare programs with incredible amounts of stress because of the amount of disruption that's happened in their very young lives, with parents who are highly stressed out, with communities that are highly stressed out, coming back into the care of providers who themselves are very stressed because maybe they had lost their income when their program was closed. Most childcare providers and early educators, they're not like K through 12 teachers. They're not on a salary. They're not union protected. When their program closes, they don't have income, and there's no margins to be able to support them of profit, and so, the amount of stress from that too, but also the fact that a lot of our providers are just carrying an awful lot of stress for other reasons, including racism. In the field of early care and education, it's mostly women, and disproportionate compared to K through 12, it's women of color. And these women of color have not only been shouldering COVID like the rest of us, but they've been shouldering it at a disproportionate rate, with a disproportionate burden. And on top of that, a racial reckoning that's happened after the murder of George Floyd. So all of those kind of things together just creates an awful lot of stress for these providers. And also remember too, that when schools were closed, childcare programs, many of them remained open, with providers who were coming to work uncertain of the risks we were asking them to take. And they came to these childcare programs and took care of other people's children while they were working, and many of those people were essential workers, and the teachers and the childcare providers in their head knowing these children are at a greater risk of getting COVID-19 because of the nature of the work their parents are doing. When we did a survey of this, looking at COVID-19 transmission in U.S. childcare programs, and we surveyed like 59,000 childcare providers, 77% of them reported that they were worried that in the process of doing childcare and providing childcare, that they may get sick from COVID-19. 74% worried or very worried that they may bring COVID-19 home to their families by providing childcare. But the largest percentage, 79%, they were primarily worried or very worried that their very presence in the child care program might get a child sick. And that was the worry and the concerns that they were carrying. And so, I don't think that we could really do a topic like this enough service, when it comes to just what it is that we're going to be asking of children and families and child care providers when they're reopening. The amount of stress, we need to be able to provide supports to that. You can go on to the next slide. And then after that, progress to the slide after that. We've been studying, on to the next slide, we've been studying children being expelled from preschool programs for quite some time now. And what we know is that children are expelled from preschool programs that are parts of school districts or funded by the states at about 3 times the rate of grades K through 12 combined. And when you're talking about childcare programs, it's about 13 times the rate. And that was before COVID-19 stress. Next slide, please. If you were to add up all the children in the United States that are expelled or suspended from childcare programs, it's about 192,000 children. You could give every single one of those children a ticket to see a football game at MetLife Stadium, or fill every seat in Yankee Stadium and Citi Field, all of that combined, and you still have 13,000 expelled preschoolers waiting in the parking lot. That's how many children we expel every single year before COVID. And my worry is that now after COVID, with the amount of stress that providers are feeling and also the children in the communities, that rate's only going to go up. Next slide, please. There's a lot of different ways that one can graph these things out. And if you can sort of like hit the, so there's the pre-K expulsion rate. And if you can hit it again, there's the K through 12 expulsion rate. And perhaps the closest thing to expulsion when you're an adult is adult incarceration. And it's interesting that the adult incarceration rate in the United States is about the exact same thing as the preschool expulsion rate. But what's more interesting is this. The racial disproportionality and the gender disproportionality in preschool expulsion is almost identical to the adult incarceration rate. The very same children that we expel from preschool programs are exactly the same demographically children that we're going to be incarcerating. It doesn't necessarily prove that there's a preschool to prison pipeline, but if there is one, it's amazing how consistent the diameter of the pipe is, all the way from preschool to the end. And I'm not saying that this means that children in preschool programs based on race and gender are more likely to have challenging behaviors. I'm just saying that if they do, they're much more likely, children who are Black and boys, more likely to be met with an expulsion as the primary response to that. You can go on to the next slide, please. The U.S. Department of Education started looking into this topic too, and basically found exactly what we were finding back in 2005. That Black children are more likely to be expelled, boys are more likely to be expelled, and if you're Black and a boy, then your likelihood of expulsion is significantly higher than just about any other child, even if you control for the severity of the challenging behavior. It's not that they're more likely to misbehave necessarily, it's just that they're more likely to get that particular type of punishment, the punishment of forcing back out of the program these children. On to the next slide, please. Now, there's been some more subsequent studies looking at like what are some of the risk factors. And some people on this webinar may have heard of ACEs, early childhood, adverse childhood experiences. So like the things that can happen in your early years that could be very stressful. And what's interesting from this one study that was done using data from the Children's National Health Survey is that they found that just about every possible adverse early childhood experience is significantly related to the likelihood of a preschooler in that home being expelled. So you could think about it this way. You know, one of the side effects of opioid abuse in a home is that your preschooler may get expelled. One of the side effects perhaps of adult incarceration is that that adult's child may get expelled from a preschool program. You know, so it's interesting to think about how recursive this is. When we expel children from preschool programs, it increases the likelihood that they're going to drop out and they're going to be incarcerated themselves later on. But also, when they become incarcerated, it increases the likelihood that their child after that will be expelled from a preschool program. It's just intergenerational, and we're setting whole generations upon generations of children up for failure. You know, it's important to realize that some of the times the disproportionality that we find in the world is there because we put it there, you know, and the inequities are there because we put those inequities there. If you go on to the next slide, please. I'm going to end with saying this, though. It doesn't have to be that way. We know of low-cost solutions that are way cheaper than the alternatives. What are the alternatives, you know, to actually providing support? Well, I suppose you could expel a child, and maybe they'll have to sign up for another year of early childhood care and education programs. Or maybe you can put the child into a preschool special ed program. Or maybe you can enroll the child in a community-based mental health program for outpatient psychotherapy. All of these things have price tags associated with them, you know, and inaction has a price tag associated with it. But what the good news is this: when we provide supports in the form of early childhood mental health consultation, we can avoid a lot of those price tags that are associated with the inaction or the bad decisions that we typically do. You know, what if instead of expelling children from preschool programs in order for them to appear in child guidance clinics, what if instead of that, we expelled the child guidance clinicians out of their clinics and put them in preschool programs where they can actually be helpful? And what we found in Connecticut is that when we actually did that, and we did a statewide random controlled trial, it significantly improved the outcomes of the children that were the focus of the teacher's concern. And one thing to also bear in mind is this: the power of a consultant to come into a classroom and to say, here are the concerns that this child might be experiencing, is also the exact same power of a consultant to come into a classroom and say, perhaps the real concerns here are not in this child. Perhaps it's in the way in which we're viewing that child's behavior. Perhaps it's in the form of the biases that we might have about certain kids in our classrooms. You know, so I'm going to leave it with that and hand it over now to my dear colleague, Dr. Chen Reyes, who spearheaded a study looking at the effects of early childhood care and education programs and early childhood mental health consultation infused into them in the state of Ohio. They had some incredible findings and some that are fairly shocking. Over to you, Dr. Reyes.
study of Ohio's early childhood mental health consultation is now available online. So all the resources we will leave later. But next slide, please. I couldn't go on without thanking our partners in all this. So I'd like to thank the wonderful state of Ohio, all the agencies, the consultants who bore with me for explaining the rigors of a randomized controlled trial, and they were all patient because they believed in this cause. And I added here like a quotation from Dr. Ed Ziegler, who's the father of Head Start. Essentially, what he's saying is that we owe the research to the children who provide us the data, so that we can use it and build a stronger society. I also want to thank the Kaplan Foundation and the Heisen Simons Foundation for funding this work. Next slide, please. So when we started getting the data, I just noticed that some of the scores that we were getting with the tool that we developed at Yale were showing some really concerning scores. So I had asked some consultants to share with us what they actually witnessed, like what were they seeing that warranted, these very low mentally unhealthy climates in classrooms. Play the video, please.
In a climate that undermines mental health, teachers are quick to scrutinize, shame, punish, say things like, "Why are you bothering everyone?" This negativity impacts all the children in the classroom. We see an increase in tears and tattling, targeting and triggering. In these classrooms, targeted children are regarded as unlikable and problematic by everyone. I hear things like, "Are you here to see Jonah? He's the bad kid and he makes the teachers really mad every day." In a mentally unhealthy climate, teachers and children say things that are unfortunate, like the little boy who said, "I wish I could wad myself up and throw me in a trash can," and no one responded. In early care and education environments, we hear antagonistic language like, "That's why you have no friends," or intolerant of feelings like, "If you're going to cry, I'll give you something to cry about," or disrespectful and threatening. "If you mess with her, I'll mess with you." Because in a climate of unhealthy interactions, teachers are so focused on their own survival and needs. The teachers have mental health needs too, and they are suffering too. As one teacher said at the beginning of consultation, "I just need something left for my own children when I get home."
So, I mean, that was quite the story. And, this all happened pre-COVID, and these are the stressors that are already happening. And let's just contextualize that now into, the pandemic that we are experiencing. We're experiencing a dual pandemic, COVID, a health pandemic, but like what was mentioned earlier, we're also experiencing a racial pandemic, and that it has an impact on all of us. Like no one is spared from both these pandemics. We are all in it together. And so what can we do? And so we at Yale love to evaluate promising programs. Next slide, please. So just to give you a brief methodology of what we had done, we collected data from 51 preschool classrooms that were randomly assigned into treatment and waitlist control conditions. As you can see on the right, there were 24 counties all over the state of Ohio that participated in this. What was the treatment? So it was early childhood mental health consultation powered by the Climate of Healthy Interactions for Learning and Development tool, which I will talk in more detail later. For the first post-test, we have 6 consultation visits, which lasted about 2 hours per visit. So it's relatively short. And in terms of how we sampled children, so we sampled 2 children that we call the target children. So these are the children who prompted the request for early childhood mental health consultation. But we also wanted to know how consultation was affecting not just those children, but also the other children in the classroom. So we're calling them the random peers for a total of 204 children that were sampled. We collected data using blind observations and also teacher behavioral ratings. Next slide, please. So let's start with the classroom and teacher outcomes. Next slide, please. So the first outcome variable that we looked at is the child tool, so the climate of healthy interactions for learning and development. And this is a research-based, evidence-informed toolkit that's designed to measure the mental healthiness of the environment. And it also provides a framework for early childhood mental health consultation and coaching. And what we mean by a mentally healthy climate in general is that it is characterized by authentic warmth and friendship, developmentally appropriate and child-centered practice, the equitable treatment of children, and a focus on fostering children's psychosocial well-being and holistic development. Now, as you can see, the tool is scored on a spectrum from undermining mental health development and learning, which is scored with a -2 or a -1. We set the baseline expectation at 0. So these are the types of interactions that you see that neither undermine nor promote learning, but it's just, okay. And then anything that goes above a baseline expectation, we call that promoting, and it's scored by a +1 and a +2. Next slide, please. And so what we found in our study was that in the pretest, as you note, both groups, the control and the ECMHC group, were equivalent at during the pretest, and they were both below what we consider a baseline expectation. So you can see a certain level of stress. But at the end, both increased. However, it was not statistically significant, but the ECMHC group scored higher. But I wanted to highlight one particular, so these are all the dimensions of the child tool on the right. So it looks at transitions, directions and rules, social and emotional learning, adult affect, and all these other dimensions. But I wanted to focus in particular on one dimension just to show you. Next slide, please. So the dimension on social and emotional learning. So this particular dimension focuses on how teachers capitalize on opportunities to talk about feelings, how teachers foster group collaboration and social problem solving. I mean, these are very important skills that children have to learn. And ask any teacher in the country, and they will say that emotions matter. But we have data now across 7 states showing that with this particular dimension, the scores on this on social and emotional learning are on average below what we consider a baseline expectation. So pretest scores, as you can see, it's pretty low. It's like very undermining, equivalent at baseline. And what do classrooms look like with these scores? So this is where teachers dismiss children's emotional expressions. They forbid negative feelings, or they tell a child to evoke a certain emotion that is in stark contrast to their actual feelings. This is an environment where teachers force apologies instead of helping children negotiate difficult situations with their peers. But at post-test, we see that the ECMHC group increased their SEL scores. I mean, not quite at the promoting level, but I mean, that was quite the jump with 6 consultation visits to get to a baseline expectation. So again, it was not statistically significant, but I thought it was worth pointing out because this is the effect sizes warrant some attention for sure. And the control group remained at what we consider the undermining level. Next slide, please. And we also looked at how teachers framed challenging behaviors. So one of the things that consultants discussed with us while we were going through this process was that when they would enter the classroom, a teacher would always say, "Why are you looking at me? I'm not the problem. Johnny is the problem. So focus on Johnny." And consultation is not about pointing out, that the teacher, it's not about pointing out that the teacher is the problem, but it's about pointing out that the teacher is the solution. And that's what we're trying to change with consultation. So it requires like a change in the teacher's mindset and how they frame challenging behaviors. So we, unfortunately, were unable to ask this at pre-test, but we looked at post-test scores, where higher scores mean like a teacher has more of an internal locus of control where they feel like they are empowered to change a child's behavior, and lower scores mean that they have a more external locus of control, that it's beyond, it's not them, it's the parent or it's the child, and so on and so forth. So we found a trend result at post-test. So teachers who were in the treatment group have increased their sense of efficacy in terms of, how they frame challenging behaviors, that they had the power to change a child's challenging behaviors. Next slide, please. So we're moving on to child outcomes. So earlier I talked about the classroom environment, but now we're looking at how then does consultation impact the children themselves. Next slide, please. So the outcome variables that we looked at were social and emotional skills measured by the DECA for preschool. So there are 4 dimensions. The first 3 are protective factors. Initiative is the ability to use independent thoughts and actions to meet their needs. Children's self-regulation is the ability to express emotions and manage behaviors in healthy ways. Attachment refers to children's ability to maintain mutual positive connections with peers and with other adults. And behavioral concern, so this is in the negative. You want the scores to be lower here. And these refer to all the other challenging behaviors that happen, both externalizing and internalizing behaviors. And what the data show is that across all children in the classroom, given that they were at baseline or during the pre-test, they were equivalent, but at post-test, we see a significant increase in the children who were part of the treatment. And I wanted to focus especially, so remember earlier I talked about sampling target children and their random peers. So let's look at the next slide. And I just wanted to, I didn't want to show too much information, but let's focus on one particular outcome variable, initiative. And so what I'm showing here is that, was there a differential effect on how target and random peers were impacted? So both, regardless of target children or random peer status, children who were in the ECMHC group significantly increased their scores on this particular across all the variables. But I just wanted to highlight initiative. And some of the sample items on initiative were tries different ways to solve a problem, or makes decisions for themselves, or the child shows interest in learning new things, or shows confidence in their ability. And look at the impact on the target children. It's about 3/4 of a standard deviation. I mean, that is a huge increase given the very short period of time that consultation happened. And it's half a standard deviation increase also for the random peers. And again, I love stories to back numerical scores. So I always ask consultants to share with us like what they were witnessing, just to make sense of these findings. And there was this one consultant who shared with us, this child, how this child grew from class troublemaker to class leader at the end of consultation. And I will use her words, like when she shared this with us. So she said using the child, so that's a child tool, during consultation helped transform this classroom into a kind and connected environment. The child who had been friendless and marginalized as the bad kid became the Lego expert and a leader, flourishing within a new safe climate of encouragement and competency building. While he still will have an occasional meltdown, his teachers and classmates help him and remind him he can handle it and invite him back into play as soon as he is ready. So it's just nice to see how what they see is actually also depicted in the numbers that we see, because we don't see those stories. Next slide, please. So what are the implications of our findings? So let's begin with, starting at what we consider an undermining environment for young children, where teachers are engaged in undermining behaviors that impede healthy brain development. So it's a result of stress in a challenging environment. Teachers are overworked and underpaid, and the demands we place on them are high, and they can't do it all without systemic support. So as a result of consultation, let's go to the next slide. So next slide, please. I'm sorry. The previous slide. Thank you. So we saw a movement from negative to a slightly more positive climate, and we saw how consultation had an impact not only on the target children, those children who prompted the need for services, but there was a spillover effect also on the rest of the children in the classroom. And this is what we're calling horizontal diffusion. However, another type of spillover effect that is untested, but it is something that we firmly believe in, is that we also believe in vertical diffusion. And what this means is that those teachers who are now equipped with the skills that they need will then have an impact on succeeding generations of children. Just a couple of days ago, I was talking to this mental health consultant who wanted to be trained on the tool so that they can train their staff in all those schools where they were providing services. And out of curiosity, I just asked them, how many children will this impact? Like training you, how many children are we going to be able to make a difference in? And then it took her like a long time to answer. And I thought, it's like, oh no, what does that mean? And she was like, it took me a while to answer, because if you're just thinking of enrollment rates, then we're going to be impacting 975 children. But if you're thinking about, how many children as a result of changing these teachers' lives will impact, then that number is, we don't know what that is. It's definitely going to be magnified. So, so just to end, there's just this final quotation that, we have to remember that, teachers essentially are climate makers. It is up to them to, we give a lot of, respect for them, and it is up to them to decide. Like, I love this last line, that it is up to them to decide whether a crisis will be escalated or de-escalated, and a child humanized or dehumanized. And so we now know that there is one potential path where we can help and support these teachers so that we can build a better society. Thank you.
Wow, it's going to take a while for us to unpack everything that you just showed us in that study. But before we do that, I want to turn now to Tina Sloan, who is an actual early childhood mental health consultant and vice president of the Early Childhood Mental Health Consultation and Training at Kidango, the program we heard from earlier. And so she's going to discuss the implications of this. And I think if you could actually talk a little bit more about the work as it relates to the staff, the professionals that you work with in the program. And because I think we haven't seen anything, what we're seeing, so much of this focuses on that person, that teacher in the classroom working with the children, where we've been sort of sidestepping some of the issues there. So Tina, I'm going to turn it over to you, but let's hear from what your experiences have been with this.
Yeah, absolutely. Thank you so much, Linda. And I want to extend my gratitude and appreciation for my fellow colleagues and human beings that have spoken today on this panel. What I first would like to say is very connected to that last quote that Chen described. And it was talking about the teacher can either humanize or dehumanize. What I'd like to offer first is that part of what consultation does is that it humanizes both the adult, the teacher, the children, and the family. What we're talking about here are not numbers, are not statistics. We're talking about living, breathing human beings whose environments impact their well-being. And in early education settings and childcare settings, we're talking about young children and young children's ability to withstand and to stand up and rebound from the stresses of life, or in light of not having stress, but just being able to learn and grow and thrive. That's contingent on the adults in their lives. It's contingent on those moment by moment interactions that happen from the moment they enter that classroom. Mm-hmm. What I also like to offer is that it is the humanness of the teacher and their ability to be who they are, to know that they matter, to be able to hold what happens in their personal life, to hold what happens in the classroom, and to do all of that and still be available and present to hold the whole spectrum of humanness of a single child, but not just a single child, but the wholeness and the humanness of 24 or 32 children. That's a heroic feat in order to do that. Mm-hmm. And we're not even talking about doing that in a pandemic. And so you can hear the impact of when teachers are not equipped or do not have the capacity, that we see the long-standing impact in the story of Tanet. So again, we're talking about lives, we're talking about human beings, we are talking about people, whether it's the child or the adult, who simply want to be seen, heard, and to want to be able to live and enjoy life. And yet there are things that impact Tanet for her lifetime because of something that happened in a childcare setting. And so that group of teachers, we don't want to dehumanize them. What we want to do is humanize them and say that there was something missing. There was a gap that occurred somewhere that disconnected them from the reasons that they became heroes, right? To be a teacher is to do something heroic. But something got disconnected, because when you enter a profession that says, I want to care and love for children, and you then ultimately conclude that this child is not someone that I can help and they need to go somewhere else, there's a disconnect that comes. And so no teacher wakes up in the morning, no teacher joins the profession and wants to have those kinds of negative impacts on children. So one of the benefits of consultation is that first, if we want to have positive long-standing outcomes for children, we need to have outcomes that are shifted for the adult, for the teacher. And so when you have stressed, overwhelmed teachers who are experiencing the accumulation of, whether it's a pandemic and you have a partner who lost their job, to having a shed that you can't use, that if your mind is preoccupied on those kinds of things, if your heart and your soul is overwhelmed by other things, how can you possibly be present and available to typical child behavior? Because I don't know about the rest of you. I have a 6-year-old. And even before the pandemic, right, there are times that just being a 6-year-old or just being a 2-year-old, it's stressful. And yet my ability to be able to take a step back and still see the goodness of my daughter, to be able to hold my stress and her stress, and to still be able to respond in a way that is kind, that is compassionate, but also supportive, that there has to be some resources that you can draw upon. And I'm not even talking about in a pandemic, a racial pandemic, a health pandemic. I'm talking about this was a need before that. And so now we have additional stressors. And so in order to have those outcomes for children, we have to pay attention and we have to give support to teachers so that they can have the capacity to hold what every single child brings into the classroom, their humanness, their stressors, and how that shows up in behavior. And we want to be able to have classrooms that are inclusive of every child that walks through that door. And so consultation is one of those really critical and important foundational support. And so as a consultant, I've been able to witness what it's like when you create a space for teachers to come together that is outside of their daily routine, outside of instruction, outside of caring for others, to first and foremost pause and connect with, where am I? How is this work impacting? How am I showing up? And am I showing up in a way that has integrity with who I want to be as a teacher and what my students and families need of me? And so it gives that space. But more importantly, it creates a space so that every child in that classroom, such as when Tanette was 2 years old and 3 years old, could actually really sit and think, let me try to understand who she is. What's happening for her in her life? How is our program? How is our classroom? How are we as teachers set up with the capacity to also include her? Mm-hmm. Are we able to not just focus on the group? Because that's important. You have 24 kids. I don't even know how they do it. I have one, right? But you have 24. So you have to be mindful of the group. But that can't compromise the need of the individual. And so consultation gives an opportunity for teachers to have dialogue, to reflect, to think about what they're bringing to interactions from their cultural point of view, from the cultural point of view of the program, to be able to uncover any biases that may have been known and unknown that are being brought into the interaction. And so without a space of slowing down, of pausing, then stop, we're going to stop and pay attention and to think about what is it that I need so that I can be about what this particular child needs or what this group of children need. high quality, inclusive programs only exist in the existence of teachers who are well, teachers who are open, teachers who are not stressed and preoccupied. Now, granted, that is always going to be part of an early educator's profession. You're dealing with other people and children, and that will always invoke emotions and stress on a good day. But let's think about what happens on a bad day, on a bad week, on a bad month, and a bad year. And so if we want to have positive outcomes for children, which we do, we invest millions of dollars for that directly. But we can see with our high expulsion rate, something's not effective. So something has to shift, something has to change. Now, I'm not saying that consultation is the savior and the fixer of all of the challenges that are presented and exist in our system. But what I can say in all of my years as a clinician, as a therapist, as a consultant, and sitting across and having dialogues, real, genuine, vulnerable dialogues with teachers, and then sitting and having real, genuine, vulnerable conversations with parents and observing children, what I've seen is the power of what happens when you're able to pour into the teachers, give them a space to be able to figure out, how can I be at my best? How can I understand the children that have been given to me to care for? And I say care for, not just educate. When they are able to care and to think and to ponder and to wonder, powerful things happen. And so teachers are the heroes in the life of children. And so we need to honor our heroes by giving them the support that they need, the support that they deserve. And it is a privilege every single time I get to sit and I get to hear and I get to be part of the journey. And the final note that I would like to share is related to what Chen also shared in terms of the impact on the target children and the other children in the classroom. And we were able to see that you can focus on one child and have positive improvement and shifts, and you don't even have to directly impact the others directly, but from being exposed. And so that teacher has an impact, not only on the children that come into their care that year. What happens in consultation has an impact on every other child that comes into their care for years to come. And so the impact is just like what Chen described, that consultant saying, I don't know, I can't say, because it's exponential. Because you sit with 3 teachers and they're teachers for the next 10 years or 20 years. How many children are they impacted? Do they impact? It's an incredible amount that we just simply can't calculate. So the investment is an investment that will continue to reinvest year after year. It's a worthwhile investment.
Well, thank you, Tina. That was extremely impactful, I have to say. I want to go now to a conversation that I want to have with everyone here, and also encourage the audience to submit questions to the chat, because Franny Einturns from our staff is monitoring those. She'll be feeding those questions to us. But I want to open up with one that I think keeps, nagging at me. And I think it gets back to where we started the conversation with Tunette. And to the extent how do we engage parents more in this conversation? We know that we do need to work with the adults and the staff, the teachers in the classroom, but that can't happen in isolation without the parents. And Tina, you sort of alluded to the talking to parents, but how do you bring parents into the conversation with the classroom teachers? How do you do that?
It's a wonderful question, and it's an essential partnership that we seek to strike. What we know from the amazing research of Walter and Chen is that children that are expelled are coming where that partnership has broken down. And so there is a critical need, again, to create space to help support that partnership. And so when there is a child, there have expressed concern. One of the first things that we do after we get consent and we do all of those legalities, we talk to the parent and we help them understand that our job and our role is to help their teachers help their child flourish in the classroom. And I, as a consultant, and these teachers are unable to do that effectively without them. And so they become an essential part of the process. So being able to hear their wisdom about their child, to be able to share that with the teachers, to promote dialogue, so being able to bring them together, to have conversations, to create a shared understanding about what's happening in the classroom. And then that means that there's shared responsibility in order to really be able to work together as a team and as a partnership. So it's absolutely an essential part of the work. And we're always thinking about that, even if there isn't a target child, that when we're sitting in dialogue, we're always considering and recognizing that the influence of the adult and what's happening with the children is an important factor. And can we see the family as not having deficit, that the challenging behaviors is because of poor parenting, but that we can look at the parent as a partner who has valuable, essential expertise to contribute to the process. And that's really what is a really core piece of child-focused consultation.
Tunette, you wanted to jump in on this one?
I do. I think I think for me, this is a question that I get asked about schools all the time, right? And we think about this, whether it's schools or whether it's, organizations that are trying to work with families. And we have to be very honest that up to this point, partnerships with parents have been like unhealthy co-parenting relationships, right? So we know, right, that we are in a relationship together, right? And I have to drop the child off to you sometimes, and you have, because we have just shared custody, but it's not healthy. And so how, right, am I going to engage when it's not a healthy relationship? And so we have to begin to repair harm. And it's no different than relationships out of sex. It takes time, but you have to be, and we have to throw the word power into this conversation, because schools have a lot of power. So when you talk about when you want to engage with families, typically it's during school hours, right, that parents might not have. So then again, it's the haves who can, right, be there, and the have-nots who can't who can't leave work and have to be other places. And so again, it's going to take a concession of power to start to figure out like what works for you. And I think some of the important elements, and I'll say this very quickly, those important elements are, what time we meet. I was working with some families who were experiencing homelessness, and they wanted to meet at 8 p.m. Now that took a sacrifice because I have 3 kids, right? Like I have my own life. I've been working all day. I'm tired, but they wanted to meet at 8 p.m. Show me the schools that are doing that more often than not. And I'll show you good examples of the relationship, but that's not really happening. And so we have to begin to shift power and think about whose knowledge, whose experience when we think about how we even construct partnerships in schools.
Mhm. You know, and some of it just gets down to basic respect too. I think about this a lot when it's just having respect for parents and sort of what they say. I think there's an old proverb that I was thinking about yesterday, as a matter of fact, that a mother knows what a child cannot say. And I think that if we don't listen to the parents on these things, then we only know half of the story here. So anyway, let's continue on. And I want to keep on this issue of I guess the impact, Chen, that your study shows on other children in the classroom and the exponential benefits of this. Have you been able to quantify that in any way? I mean, I know that's a hard thing, but I think as we move forward with mental health consultation in this country, I think our audience needs to understand that the impact of this is so consequential. I don't know, Walter, I don't mean to put you on the spot, but Walter or Chen?
No, that is an excellent question. I wish we can quantify with research, and if we build structures into systems that enable us to obtain data, that would be very helpful. That would be a good investment of resources.
Well, this much we know.
Okay, I'm sorry, Walter, go ahead.
Well, that's okay. This much we know. There will never be enough helpers to be able to help every single child and family and teacher who needs it one at a time. We need to be able to have models where we can go in to help one child and their relationship with their provider and the family in ways that provide residual benefits for all the children. That's literally the only way that we can ever possibly get ahead of this. We have to have some kind of economy of scale. And that's the stuff that Ms. Sloan was talking about earlier. You know, it's the notion of how do we go in knowing that the concerns are probably going to be emanating because of a teacher being concerned about an individual child, but do that work in a way that it benefits all of the children and maybe even changes and helps support that provider to be better for future generations of children that are going to be in their care. What we don't want is like mental health consultants who come in, pull a child out of a classroom and try to do mental health magic in the hallway, then reinsert them, because it probably won't work. And second, if it did work, it would only help one child. And third, it plays into a narrative, and I think this is what Dr. Powell was talking about before. It plays into a narrative of pathologizing that child. That somehow there's something wrong with that child, and it might not be anything wrong with that child. It might be something much more systemic. And for systemic issues, you have to have a systemic solution.
You know, I think that what you're touching on too, and I think we've long known this, is the preparation of the workforce. And I think that we do have challenges in terms of preparing. You alluded to some of the issues of pay, et cetera, and the churn in the early childhood workforce, especially right now because of the pandemic, is even more challenging than normal. And so how do we keep a workforce that is well trained and knows some of this to begin with, so that we're not going back in and teaching some of these things? But that's a sidebar. Let me go to Franny. I think Franny, you said you have some questions now.
Yes, we do. We've had 2 questions come in specifically around the shortages of ECMA professionals. The most recent one came from Philip Accord. He asks, what can we do to address the serious lack of mental health professionals to help those of us who run early education programs, especially those of us who serve children that have high ACEs?
Walter, how would you like to take that one? I know you spent a lot of time looking at this.
Yeah, we have, and I'm going to also bounce it over to Ms. Sloan to talk about, because she's engaged specifically in that kind of work. You know, but I think, you know, there are indeed there's not enough mental health professionals out there. However, there are some that are indeed out there, and they could be retooled. You know, but the model that we typically have right now is that children are mistreated enough that eventually they end up in somebody's mental health clinic. And what we need to be doing is we need to be getting those mental health providers out of their clinic and deploying them as primary prevention forces in things like early childhood settings, and so one way to think about it is that in many cases, these professionals do kind of exist out there and they could just be retooled. We could also be thinking about child protection service workers and social workers. What if instead of spending so much of our effort in thinking about how to utilize that workforce primarily to respond to fires, we use them as people who can actually prevent the fires? I think there's a lot more that we could do if we just thought more about mental health supports instead of just thinking about punishments.
Mhm.
Yeah,
Tina, how about you?
yeah, I'd like to add to what Walter was sharing is that there are mental health professionals out there. However, I think that part of the lack of early childhood mental health professionals partly stems from young children need mental health, infants, that there needs to be like mental health services to 2-year-olds, and infants. And I think in particular, because you think about mental health, oftentimes it's directly associated with mental illness. And certainly young children can be impacted by trauma and other things, but promoting the mental health of young children. And so I think that, part of what we're doing as part of Cadango and across and our advocacy across California is how can we actually create more awareness within our mental health community about the essential preventative work of early childhood. And as a clinician, I work the whole spectrum of childhood. And one of the things that prompted me to do early childhood work was, wow, I'm sitting here with a 16-year-old that has been experiencing multiple things in their life since they were an infant. What if I got involved? So I think being able to tap into the mental health workforce, and we're working to do that within California to create more awareness, and then to be able to prepare and train and educate so that they have the specialization that's actually required to work with young children, but to do the dual work of working with the adults and the young children and recognizing that working with them together is what is going to be what boosts the outcomes. So I think, part of it is a campaign of awareness. And then it's about tapping into the resources and helping to prepare that workforce to support the ECE workforce.
Mhm. Okay, Franny, you have another question there?
We do. This is from Deb Kong, and she asks, given the importance of this, how can states use the American Rescue Plan Act funds to support IECMHC? Does Tina have particular perspectives on what this might look like in California?
I'm sorry, can you repeat the question? At a two-part.
Sure.
Yes.
It is. Given the importance of this, how can states use the American Rescue Plan Act funds to support IECMHC? Does Tina have particular perspectives on what this might look like in California?
Let's go first to Walter on that one. Walter, on a national level, what would you say how states could use this money, and then we'll go to specifically California.
Sure, and I'll try to make it quick. I mean, the amount of money that's coming in right now through the American Rescue Plan is a lot of money. And a lot of it has to be obligated very fast. 24 billion of that, half of that has to be obligated within 9 months. And so how do we work with states to help states build the infrastructure for early childhood mental health consultation? Because that's, in many cases, those are high upfront costs. How can we build an infrastructure that would allow us to be able to have efficiencies later on down the road? Things like, can we build HIPAA and FERPA compliant platforms that mental health consultants can work through? Can we build systems for tele-mental health consultation so that we can go quicker and easier into programs and form relationships between parents and providers at a more cost-efficient way. In a way, the thing that we need to be aware of is that whenever there's inefficiencies almost always create inequities, because inefficiencies mean that some people will get it and some people won't. And you and I both know who won't. And so if we want to be able to create a more equitable system, in many cases it means creating efficiencies. And so one of the things that I would suggest for states to be thinking about is, don't fall into the trap of trying to buy the train car. Buy the rail system now. You have the resources, create the infrastructure so that you can then be able to have greater efficiencies down the road by buying those online platforms and other types of things to be able to create a much more efficient system. So then over to Tina.
Yeah, Tina.
Yes, I'm really going to emphasize exactly what Walter has shared. That we are really working in terms in California. How do we build an infrastructure that allows access to consultation across the state, even in the more rural areas, and that they can have access to consultants who may not be in that particular rural area. The other area of investment would be in what I would describe as startup costs, right? There are costs for programs to really think about and to determine their readiness, and then to create the shift in their programs and needing to be able to have support. And how do you bring a quality, effective early childhood mental health consultation program? And being able to have those funds available to work with experienced consultants, to be able to work with those programs, and putting in those what did you call them, Walter? The train rails, and then from there we'd be able to scale and to go deeper into the work.
Well, I see that we're running out of time, and I just wanted to remind people that this is a time like no other for our field, and that because of what we just talked about, the ARP money and some of the other things available, now is the time to invest in some of this. And we all know, just judging from the studies that you saw, but the long-term consequences that we've heard about today from Tunette and people who actually have lived this experience, it's an investment. It's more than overdue for this country. So we want to, through this, encourage states and communities to give serious thought to this model, because it is going to more than pay for itself down the road with our children and our families. So I want to close by thanking all of our panelists today for a very rich and informative conversation, and heartfelt. I think that what we need for our audience to understand is, what lies beneath this topic and how important it is to the future of our children, and to sort of getting us where we need to go with a more equitable system for all of our children, and keeping our children in these programs happy, well-adjusted, and their parents feeling very good and secure about what's going on. So with that, I want to thank everybody again, and hopefully you will all have a very pleasant afternoon, and thank you again for joining us.